Dr. Hilary joins me for our new series, Open Surgery. As you can see, we have lots of people standing by in our virtual waiting room, ready to get their health questions answered. Shall we kick off, Hilary?
Let's go.
With Heather, first of all. Heather's from Staffordshire. Hi, Heather.
Hiya.
Hello, love. I know you've had endometriosis for the past 3 years. What do you want to ask Dr. Hilary?
Well, basically, I've been suffering, like you say, for the past 3 years, but it could be more. I get taken into hospital monthly, maybe weekly, sometimes more due to pain and different symptoms. I've had 2 positive cancer tests for cervical cancer, and they're not doing anything about it because I'm too young. And I just don't know what to do.
Gosh,
oh, poor thing, Heather. Listen, you're not alone. 2 million women in the UK have endometriosis, and many of them have to wait up to 7.5 years before a diagnosis, because it's not always that easy to diagnose. But what's the main problem? Is it pain?
Yeah, I'm in so much pain. I've had to give up 2 jobs. I've got 2 kids and I can't play with them properly anymore.
Well, that's no good. Listen, it's a common situation, Heather. If I can just explain to viewers, I think we've got a couple of pictures here that we can show to explain what endometriosis is. But basically, the tissue that normally lines your womb, you can see there in the middle of the womb, in cross-section there, that tissue spills out along the fallopian tubes, covers the ovaries, covers the outside of the womb. It can stick to the bladder and the bowel. So you can get all sorts of pain, particularly at period time, but in between period times as well, and when you want to be intimate with your partner. So that pain you don't have to live with. The first thing to do is to be referred to a gynaecologist. There are treatments. Have you got any children?
Yeah, she's got 2.
Got 2 children,
Yeah.
yeah. Fine. So fertility may not be all that much of a problem, because you could go onto the pill, either in pill form or patch form, which would almost stop your periods and stop a lot of the pain. Alternatively...
I've got the coil.
OK, good.
All right, OK.
Good.
I'm worried as well, though, that she said that, you know, that Heather was saying that she's had 2 positive cancer. Yeah,
now that I don't understand that. If you've had any abnormal cervical smear, it needs to be repeated. It could be that they just saw some blood or abnormal cells which was within the realms of normality, but whatever your age, if they found an abnormality, it needs to be followed up.
Absolutely.
So you can talk to your GP about that, and you should. But as far as the endometriosis is concerned, you've got options. There's medical treatments, there's surgical treatments, laser or diathermy through a laparoscopy, where they put a little tube through the belly button. You've had that done?
Go.
Right.
Yeah, and they found that my bowel was attached to my left ovary, but they said it's too deep to operate.
OK.
Do you know what we need to do, Heather? I think we need to stay with us, and we'll talk to you more, because obviously there's a lot more to this.
But there's certainly a lot that can be done, and I don't think enough has been done for you at the moment.
Definitely
not.
Don't
give up hope, because it's not curable, but it's certainly manageable.
Yep, stay with us,
I'll be back to you.
Stay on the line.